The News Hour Special Edition.
Welcome back. The monkeypox scare has now reached the national capital. Delhi has reported its first case of the virus after a 34-year-old man with no history of foreign travel tested positive. Now this, remember, is India's fourth case, with the remaining 3 coming in from Kerala. Now, as far as Delhi's case is concerned, a 34-year-old man tested positive after he attended a stag party in Himachal Pradesh in Manali recently. However, once he started showing symptoms, he was admitted to a Delhi hospital. That was 3 days ago. Now he has been isolated at the Lok Nayak hospital here in the national capital. His samples were also sent to the NIV Institute in Pune. They were positive, which is why now close monitoring is taking place of his contacts. Tracing and quarantining of those contacts has also begun. Now this comes just a day after the World Health Organization sounded its highest level of alarm for monkeypox. They declared it a public health emergency of international concern.
The outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories. The information provided by countries, which in this case shows that this virus has spread rapidly to many countries that have not seen it before. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. There is also a clear risk of further international spread. The global monkeypox outbreak represents a public health emergency of international concern.
Dr. Rajib Dasgupta, task force member, joins us on this broadcast. Dr. Sushila Kataria, Senior Director of Internal Medicine at Medanta Hospital, also with us. Dr. Kataria, I'd like to begin with you. Now, there are just 4 cases for now in the country, but the outbreak has seen several deaths as well, especially coming in from the African continent. But 75 countries so far have reported this virus, which is why it was declared a global emergency yesterday by the WHO. How do we ensure that we are safeguarded from this particular virus? Because we saw how it began with COVID as well. It took very little time for it to spiral out of control.
Right. I think the right information and taking precautions accordingly is the only way we can safeguard ourselves to this monkeypox infection. Fortunately, the spread of monkeypox is not as fast as it was for COVID-19. It is more because of very close skin-to-skin contact or because of the droplet for a very, very prolonged exposure. So it is not as contagious as COVID-19 was, because in the last 6 months, we have seen 16,000 cases, 77% in the July month. But a similar, if we compare with the COVID-19, in 6 months, it has spread to like millions of cases. So this is a good thing, but we can't be relaxed on that. Particularly for a patient who has not had a significant travel, if he's testing positive, that means there are other people who are not diagnosed yet and they are in the community. So we have to trace all the possible contacts, isolate them, isolate till they are completely healed, which sometimes can take up to 2 to 4 weeks, which is little more than what is for COVID-19. It is definitely more than chickenpox and what we had earlier with smallpox. So we have to isolate these cases, a very meticulous contact tracing, testing of these patients, honest isolation of these patients, and not stigmatizing the patients, because otherwise the patients will not come forward and there will be under reporting of the cases. The cases will continue to spread without our knowledge.
Right. Dr. Dasgupta, the centre, of course, has been in a huddle. We do know that there was a meeting held today as well. All states have also been asked to up their surveillance and to ensure that contact tracing is done at a fast-paced manner as far as cases that have come to the fore are concerned. But what are the precautions that can be taken at the state and a centre level? Quarantining for only those who are affected and their close contacts, of course, is protocol number 1. But what about everyone else? Are we going to see quarantine or isolation protocols like we saw in when COVID hit as well?
Thank you. Now, perhaps the only thing common with COVID is that it's a new entity. There's hardly anything common with COVID. But the advantage of the country at this point is that we are now geared down to state and district levels to engage with a new entity, which the monkeypox is. It's not a new disease, but certainly the current ongoing outbreak has very key distinct features. First, that 99% of the global cases are males. Most are in the 17 to 44-year age group. Those, some, very few though, are actually in the 0 to 17-year age group. Also, among those reporting their sexual orientation, 60% are either gay, bisexual, men having sex with men. Therefore, this is a very specific group. We have the experience of HIV/AIDS, and therefore there's a lot that is known in the country of how to, as our co-panelist said, approach this group with empathy and avoid any stigmatization. There isn't any general scare at present. But the other thing to remember, two key things at this point before we get into a larger discussion. First, that the entire system has to be trained or geared up to actually pick up the cases, and many of the clinical presentation is atypical, not exactly the standard textbook case definition of monkeypox. So that's a challenge, and world over, most of the cases have actually been picked up at primary care settings or sexual health clinics. And secondly, that at least 25 cases globally are among healthcare workers. So there is a distinct possibility and entity that this may spread in healthcare settings, and therefore healthcare workers are a special group.
Right. So as of now, it's not an alarming situation, but we must proceed with caution. We must take every precaution. And if anyone comes in contact with anybody to have even suspected monkeypox, they should test themselves. They should isolate themselves and be in quarantine once confirmed. I thank you both doctors for joining us here on this broadcast and allaying some of those fears. With that, we're slipping into a quick break, but lots more lined up for you on this edition. Don't go anywhere.
The News Hour Special Edition.